doing here is we're checking in a dental for surgery. So I'm gonna find him on the Cornerstone schedule, and we're just gonna check in. So right here, I'm just gonna tab down and then check in. And it's gonna open up my dental anesthesia consent form. So this is just asking when the pet's last meal was. So okay, so up here it's just going to ask some questions. It's asking about pre-surgical blood work. This patient is current. It's asking about microchip. We're not going to do a microchip. He is not due for any vaccinations. He is a cat, and he has previously been tested for feline leukemia and FIV. So now we're just going to sign. Okay, and then this will print out the document. And we'll just close out of here. Okay, and then we'll hold it on the side. There we go. Okay, so now I'm gonna go into Romper's information right here. So this is just giving me his information as far as like name. He's a feline, he's a neutered male, 9 years old. And then right here we've got everything like medications that we've sent home, any medical notes. He does have a heart murmur, so we're going to take that into consideration for his dental. And right here, this is just showing that he's current on all of his vaccinations, and then his summary. So this is all of his history. And then another thing that we're going to do is just go over the estimate right here. So this is just showing a low and a high end, and the things that make the difference is like blood work, if we're going to run it in-house or out-house, all of our medications, and another big one that is making a difference is if we're going to do any extractions on here. So I'm just going to finalize this. Okay, I'm just going to request a signature. Okay, now he's all checked in. Okay, and now I have his cage card. Again, just going over who he is, what he's here for. I'm just placing his identification band on him.
You already getting sleepy? You look so sad.
Okay, now he's ready to go. So now I'm going to go to my patient's the LE diagnostic, where we're going to request the blood work, and I found him right here, Rowdy. So we're going to create. Okay, so it was created. So now we're going to go print it. Okay, so we're sending this low-dex suppression test into TVMDL. So I printed this out of the files on our computer and went to the TVMDL website to get my FedEx slip. So once all this is done, once I have my third sample, I'll be placing this order slip with all the information into this bag, and then putting it in here with ice bags, and then putting this form on top to be shipped to TVMDL. Okay, so during this feline OHE, I'll be recording vitals every 5 minutes. I have an anesthesia record right here, and it just has client information, patient information,
And then right here, it just says we're gonna be monitoring every 5 minutes, pulse, respiration, blood pressure, SpO2. We're not doing CO2 because she's on an rebreather. Temperature, isoflurane percentage, O2, how many liters we're using, mucous membrane, and capillary refill time. Okay, now we'll be doing an exam on this kitten, who's obviously pretty feisty. So just the same thing that we did with our dog. With kittens and puppies, it's kind of good to make for sure that they're losing their teeth normally. Okay. Just making for sure you're not seeing any fleas or anything. Okay. I know. Be listening to her heart. Hold on, it's okay. Okay, respiration was 42, heart rate was 180, which that's pretty normal for kitty cats. And now I'll be getting her temperature. I know, it's almost over. Almost over. Good kitten. I know. Almost done. All right, her temperature is normal, 101.4. So now again, we can let the doctor know of our findings. So discharge instructions for really any surgery would include to ask the owner to check the incision at least once a day, look for any redness, swelling, discharge, anything like that around the incision or on the incision. Also, you want to look for any vomiting, diarrhea, just any behavioral change to the patient. And also the day of surgery, when they take them home, small amounts of water first, and then offer them some food, usually half of their normal meal. When sending home any medications after surgery, you just want to make for sure that the owner alerts their veterinarian to any adverse reactions or any vomiting or diarrhea, especially if it is dark in color. Another thing that you want to go over during discharge instructions is making for sure that the owner knows if there is any sutures or staples that need to be removed, or if glue was just used, and follow up any rechecks. Make for sure that you're making those before the owner leaves the clinic. That will be just very important information that they know whether or not they need to come back or make another appointment. I will now be assigning ASA scores to the patients that I examined. What this is it's basically just an assessment of their anesthesia risk. The two patients that I examined are on different ends, with the kitten being young, healthy, and no known underlying conditions. So she would be an anesthetic risk of 1, which is minimal. My canine patient, he is a 10-year-old Mastiff. He recently had blood work, and his blood work showed unremarkable. That did include a urinalysis. He doesn't have any known underlying conditions. He's pretty healthy for his age. So he would still be at a ASA grade of 2 just because of his age. We're going to go over restraining techniques. The first thing that we're going to go over is how to hold for a jugular blood draw. So you just want to make for sure that the patient is sternal and straight, and everything is out of the way, so no collar or anything, and just make for sure that you're keeping their legs straight like that. Sometimes you can bring them in, and that will give the person that is drawing the blood just clear and free access to the jugular vein. For cephalic vein, you can hold the patient like so, and then that gives you a free arm to hold the leg extended out straight and just to occlude the vein. For saphenous blood draw, a lot of times we like them to be in lateral position, especially if they're small. So the holder just wants to make for sure that the knee is in a locked position so they can occlude the vein and keep that leg straight out for the person that is going to draw the blood. It's just showing how to properly put a patient in the cage. Good boy. Take all of his items off, put it in his basket. We've already put a little tag around his neck, just identifying who he is with the clinic's number. For sure the cages are shut, and then this is just his information showing what he's here for in his week. Just gonna pull this patient out of the kennel and get the leash on first. Good boy. Okay, so now I'll be placing this feline patient in a kennel. So I'm just gonna kind of hold on to his scrub and just gently place him in here. So this is how I would get a feline patient out of a kennel. Just gently by the scrub, supporting the whole body. Okay, so we're gonna just put a little muzzle on our patient, just for safety reasons. Okay, get one finger in and fix it. Looks good. I'm going to be fitting this baby for an e-collar. I know. I'm such a sweet guy. Okay. Just fastening them into place. For sure I can get a couple of fingers under there, but it's not too loose. Okay. I'll be performing a physical exam on this canine. I'll be starting from head, working my way down to tail, just kind of looking at the overall dog, checking to see what grade of dental, tartar, and calculus they are. His teeth just got cleaned, so they look pretty good. Checking gum color and capillary refill time. Looking at his eyes, just making for sure there's nothing obvious to inform the doctor about. Just taking a quick peek in each ear. Just kind of working down, making for sure we don't feel any lumps or bumps. We don't have any painfulness when we're manipulating. Come on. Can you stand? Yes. Okay. There we go. Yep. Okay. Making for sure they're not painful or you don't feel anything odd. Now we'll be getting TPR. So I will be starting by listening to the heart. Okay, turn this way. Good boy. He's not panting. If he were, I could just, the wrist that I have my watch on, I can just gently close them out if needed. Now I'll start to listen, getting a heart rate. Listening to the other side of the heart. Heart rate was about 108. Not hearing any murmurs or anything like that. Okay, now respirations. Okay. That field sounded clear. Now I will be getting his temperature. So I have my thermometer that already has a cover on it. It's been previously lubed. Okay, his temperature was normal, 100.6, so now we can let the doctor know our findings. So I'll be drawing from the cephalic vein. I have my holder who's going to occlude the vein for me. I'm just going to put some alcohol so I can visualize it better and just kind of clean the skin. There you go. Good girl. I don't need much because this is going to be for a heartworm test. So now my holder is going to hold off so we don't cause a hematoma. Dousing all this here with alcohol.
Alright, I'm gonna get it in here and I'll give you a call when it's ready, okay? Alright, I'll talk to you. Yes, ma'am.
Alright, so we're in. Just drawing back. So now my holder will hold off right there. I'll be placing the blood in my lavender top tube first. And then serum separator tube. I have my tubes labeled. And from here I will be preparing it to send to the lab. Okay. This is a canine saphenous blood draw. My holder is occluding. Looking at the vein right there. Now I'm taking my needle out. She'll be holding that off. I'll be drawing blood from the femoral vein of this kitten for a FELV FIV test. My holder is holding her laterally and then occluding the vein for me. I don't need much, just a couple of drops. So now I will be holding off, and then I'll ask Jackie to hold off for me just to reduce the chances of a hematoma. Other things that we might include just to add to our diagnostics, especially for older, sick, debilitated animals, is we might do radiographs just to check maybe like the size of the heart, just to make for sure the organs are normal size, just things like that, and we can see them accordingly on the radiograph. Other things are like the ECG, just to make for sure that the heart wave and rhythm are functioning properly. So just anything to reduce the amount of any underlying problems before anesthesia. When picking out a protocol for anesthesia, you want to make for sure that it's done on an individual basis. So you want to look at the overall patient. You want to look at age, status, if they're injured, or if they have any known underlying conditions, because this could affect the medications that you use. Things like Dextome and butorphanol, midazolam, things like that are sedatives. But some are more easily metabolized than others. Dextome does have a reversal agent. And then, when you're giving an induction, you want to make for sure that you give it properly so the patient does stay asleep during the whole procedure, and that upon waking, they wake up fast, but they don't wake up restless or painful. And during anesthesia, you also want to make for sure that you're watching the gas anesthesia that you're using, again, just to make for sure that you're using it at the lowest dose. So again, they do wake up well. And also, just using things that are easily metabolized. So we have a lot of different stuff that we can use, but the main ones that we use, especially post-operatively for pain, would be buprenorphine. So just making for sure that you stay up to date, what these things are used for, how they're used, and what part of the body they do affect, is going to help you and just make you a good assistant to your doctor and help you provide the best patient care that you can. So now I'm gonna log my controlled drugs. So you can see right here is buprenorphine, Alfaxin. We use Cornerstone. So what we do is we generate this through the invoice, and then we print out our stickers that has the information, clinic's information, the doctor who gave the orders, the client name, the patient name, RX label, what it's for, drug, and the concentration of the drug and the quantity that we gave. So in here we have our lockbox, and then next to it we keep one book of the controlled drugs. This doesn't include like euthanasia solution, things like that, so that the doctors only have access to. So what I'm going to do right here is, you can see that we all have them labeled. So I'm just going to find what drug, buprenorphine, make for sure that they match, and I'm just going to find the sheet that we are using currently, and I'm just going to place my label right here, and I'll do the same thing with Alfaxin. So again, I'm just going to take my label, and now my controlled drugs have been logged for my procedure. In this video, we're going to talk about the anesthesia machine. We'll start with the O2 concentrator that basically just pulls O2 from the ambient O2 from the room, and it delivers the oxygen through that way to the patient, either through the rebreather or the non-rebreather. It does have a E-tank behind there, just in case it ever malfunctions. We could go ahead and start the E-tank and push the oxygen through that way, or in times of if we have a patient that comes in for emergency purposes, because this actually is not going to give us enough PSI to get through to the patient in cases like that. So again, back there is the E-tank. We've got our O2 concentrator on, which I'll be showing you in a minute how to
to check for leaks. Right here, this is where our oxygen is regulated, so it is in liters, and right now it's at 2 liters, so you can move it lower or higher in case you're using a non-rebreather. But we're going to leave it at 2. Right here is the O2 flush valve, so that can be used if you're trying to eliminate the isoflurane or sevoflurane before hooking it back up to the patient. It can also be used like if you're checking to make for sure there's no leaks in your tubes. Then we'll just go ahead and move on to our Y tube. This is for inhalation. This is for exhalation. Right here, this is just telling us how much PSI is being delivered. So whenever you're bagging, you want to make for sure to pay attention to that and make for sure you're not giving them too much, which would be over 20 PSI. Right here is our bag. This is just going to make for sure that our patient is breathing. That's one way for us to see. Also, it's going to hold oxygen and it's going to hold gas anesthesia that will be delivered to and from the patient. So this is used with a rebreathing unit. It's different for a non-rebreather. Up here we have our pop-off valve. So this opens and closes. We've actually got a spot on here where we can close it off. It just eliminates the risk of somebody forgetting that they closed it down. Again, we can use this whenever we're checking to make for sure the endotracheal tube is in properly. Also, we can use it if we're checking to see if there's any leaks or if you do have to bag the animal. It's going to help to build up that pressure enough to get it to them. And then right here, we have our soda line. So that's just going to tell us or make for sure that the carbon dioxide is being eliminated. And if it turns purple or over a certain amount of time or surgeries, we're going to make for sure that this gets changed. So right here, this is hooked up to the F-air canister, and this is just going to gather any waste that is coming out from the patient. Over here, we have the isoflurane. This is the vaporizer that we use. This is for isoflurane. And we just want to make for sure that it's holding. So over here, we can see the little gauge right here. This is where we fill it up. And then over here is sevoflurane. We don't use it that much, but same concept. So now this is the non-rebreather. This is used for patients that are about 10 pounds or less. We're going to take this tube right here. We're going to hook it up. This is where the gas is going to be delivered through, and then the waste that's coming out of the patient will be delivered into our F-air canister. So again, this is for patients 10 pounds or less. But now going back to our Y tube, I'm going to check and make for sure that it's holding. So I'm going to take my thumb and put it over the hole, the end of my Y tube. Okay, and then I've got the pop-off valve down. I'm just going to fill that up. Okay, and right here, you can see the gauge is not going anywhere. So that tells me that the tubes, the bag, the machine is holding and working and ready to go. Okay, so now I'm going to get my patient hooked up to all of the monitoring devices. Blood pressure. This is going to tell us pulse ox, so oxygen saturation and respiration.
going to give us our heart rate. So we already have our trach tube placed in, so I'm just going to go above it and place it until it starts to read. We're going to talk about how to place a gastric tube in a dog or a cat. The supplies that you want is, this can be used as actually a speculum, so you can place the tubing down, and you're going to want to insert it down to the last rib. And then you're obviously going to want to have a little bucket to catch it in. Usually if it's a larger dog, you're going to want a larger bucket. Times that you would do this is if they came in for bloat, if there's something that corrosive that they have swallowed, or just any time that you're going to do a gastric lavage. There you go. Okay, this video I'll be putting in a catheter and inducing for anesthesia, so I just wanted to show that my preceptor is here and overseeing all this. Yep. Okay. So since this is a dental procedure and it's not for hospitalization, I'll just be clipping a little square. All right, buddy. I know it. I'm going to be shaving enough to where my catheter won't come in contact with any hair or debris. I'm going to go ahead and grab the light. I have all my supplies right here. I have my tape, my catheters, my plug, some gauze squares, a red vet wrap, just to indicate that we have catheter in flush. So now I'll be doing 3 scrubs with chlorhexidine, followed by alcohol. Just to make for sure that we have an aseptic area to work with. Dry a little bit, just make for sure that it all stays out. It's not being very cooperative. Flush my plug. There's different ones on here. Oh, there are. Okay, so now my assistant will be occluding the vein up in the crook of the arm. So I can see that the vein is distended right here. I'm placing a 20 gauge catheter. I'm going to place my thumb next to it just to help with any rolling. Okay, now Jackie's going to occlude above the catheter. And then I'm going to be placing my plug. sure that it's anchored in and it won't fall out during the procedure.
CD dime. Let's go find the CD dime. Ladies, so when you guys finish getting that one ready,
Before I go any further, I'm going to flush it.
run for a horse. So you guys,
Jackie's going to be checking to make for sure that it is in the vein.
Hannah will tell you what we need.
Okay.
She's got to go.
Yeah, okay. You can see a little back flash right there. And then lastly, I will be putting some red vet wrap, again, just to indicate that we do have a catheter in. This will be for administering IV fluids during the dental and whenever we give our medications to induce for anesthesia. So now I'm going to fit for an endotracheal tube real quick before we induce anesthesia. So different ways you can check to measure the septum. So this looks like it would be a good fit. Then I want to measure to make for sure that I'm not going to go past the thoracic inlet. So it looks like my tie is going to be about right there. I've already checked the cuff, it's viable. It holds 12 cc, so I'll keep that in mind when I intubate. Just fitting reasons, make for sure we don't have any leaks or, you know, he doesn't have any ability to regurgitate after. So now that we've done this, now we're going to induce for anesthesia. This is Alfaxin. We'll be giving it IV.
Okay.
We're going to be giving to effect. We've got our doctor right here.
Okay.
For sure that I'm in the plug. Okay. I'll be titrating this. Again, just giving to effect. So we're going to be watching for his head to drop. Jackie will be checking for any tension in his jaw.
And we've seen that before, so it should be
Okay. Okay. This guy didn't really have any pre-med sedation, so just because there's some concerns about the last time that he had anesthesia. That's why we're having to give him more. We're going to try to keep him sternal. Lubricating my tube. Visualize where I'm going. Okay. Close. So I'll be tying behind his canines. We'll go ahead and move him back real quick. And we're going to get him hooked up to the machine. Jackie will do that. Pretty big fit, so I'm going to be putting in 6 mils. I want the cup to be a little bit bigger, so I'll put 2 more mils in there. That'll be good. Be lubricating his eyes. Okay, now I'm going to check for any leaks. Just make for sure I can't smell any gas. Okay, that's good. And then Jackie's going to be checking manually, making for sure I'm in the lung fields, both of them. Okay, all right, we're good to go. I'm going to show myself putting flush in this. Sarah, if you want to go ahead and hold that on. Check it. Do you want to go ahead and see if you can feel it? So you can feel it on the thing. And flush it easily. Okay. Now I'm just going to put my vet wrap on it and we're good. We're going to be administering an intramuscular medication. This is the sedative this baby's going to be having a dental. So we've got the orphanol atropine, and dextone. So I'm just going to be making for sure that I don't hit the femoral artery. So I'm just going to keep my thumb back there. Ready? 1, 2, 3. Okay, we're done. Okay, so this is giving a sub-Q injection. I'm just going to pull the skin up, pull back, and I'm done. Okay, so we'll be doing an IV injection. And we'll go ahead and occlude the vein. You can see it didn't blow, so we got it in there. I'm just going to express the bladder. Starting at the end of her xiphoid process, going down to her pubis. We'll also be repairing this hernia in her inguinal area. Okay, you can go ahead and stop it real quick. Okay, so now we'll be scrubbing this area with chlorhexidine scrub and solution. So this will have some residual effect even after the surgery. So I'm just going to be starting at this incision line, working my way over here. This one's a little bit different because we'll have a couple of incisions, more than likely. Okay, and then we'll be doing 2 more scrubs whenever we go into surgery. Okay, so now we'll be moving her to surgery. So we'll turn the ISO off and disconnect her. She's small, so I'll just be carrying her in a towel. Connected, her oxygen's on. I'm gonna turn her on too. Getting her into position to have her surgery, which she will be dorsal, and then we'll be tying her legs back. Get them out of the way. While I was in here, the towel kind of touched the surgical site, so I'll make for sure to re-scrub that at least 2 more times. Okay, so now we're going to do our final scrub. And move on to this area, since that's our second surgical site. Again, this is chlorhexidine scrub and solution. And I'll just be finishing with a little alcohol. Okay, the surgery that we're performing again is a canine OHE. And earlier we were having issues getting the blood pressure to read, and then we were getting some low readings, so we kind of messed with the cuff a little bit, and then we informed the doctor, and he wanted us to wait to see what he got in the surgery. And we are getting a better reading. Our last one was 114 over 49, or 59 rather, and then the mean is 77. So the systolic number on top is 114, systolic is 59, and then again our mean was 77. Mucous membranes are a little light, but her capillary refill time is still less than 2. She is stable again. She was kind of getting light whenever he was pulling on that right ovary, so I'm going to turn her back down now that we're more stable. I'm going to manually listen to her heart rate without getting in the surgical field. Listening to her lungs. And I'll be recording what I get and then matching it to what my monitor says, which they are on target. And I will be taking more vitals every 5 minutes.
So we're going to be talking about what to do if you need to do CPR on a patient. The first thing that you need to do is try to get their attention just to check for alertness. So you can do this by clapping your hands, you can yell out their name. You also want to inform the veterinarian on staff and then get other technicians or trained staff to come in and help, because you're going to need several people to rotate doing chest compressions. You're going to need somebody to check for respirations, and then you're going to need somebody to be just checking the overall patient, placing a catheter, giving medications from the crash cart, things like that. So if your patient is intubated, you do have an open airway. So in this instance, you can use the AVMA bag. So this just attaches to the endotracheal tube where you can deliver respirations at a good rate. If the patient is not intubated, this does work also with an oxygen mask over the patient. So, and then when doing chest compressions, depending on the size of your patient, if you have a deep chested dog, you might be in the dorsal position. So, and this might mean that you're doing chest compressions this way in a solid movement. You want to do it at a rate of about 120 beats per minute. And a little fun fact is a good rhythm to go by is that song, Staying Alive. So, and again, this can take a lot out of one person, so you do want to be rotating so you're not causing fatigue. On a small patient, you can do chest compressions in a couple of different ways. You can take your hand, place your thumb on the upper part of the chest, and then place the rest of your fingers on the other side, the opposite side, and just do your compressions this way. Or you can actually use both of your hands that way. So now I will be scrubbing for surgery. The first thing that I'll do is go ahead and rinse from the tips of my fingers down to my elbows just initially. And this is not going to make my hands sterile, it's just going to get off the majority of the bacteria. Now I'll be taking my scrub brush, using the sponge side. I'll be starting with my index finger and working my way around, starting at the tips, treating my fingers like a box, so on all sides, doing it 10 times. Hold on,
moving on to my other hand, starting with the tips of my fingers. To the side of my hand, into my thumb. To the back. And this is just getting off the excess bacteria that we carry. My hands will not be completely sterile. You want to be careful not to scrub too hard because you don't want to exfoliate your skin and bring more bacteria up. Okay, back of my arm. Okay, now I'm going to rinse my hands off, again starting from the point where I started down to my elbows. Let me start that over. So now I'll be taking my the sponge side of my brush. I'll be starting with the tips of my fingers and then treating my fingers like a box, starting from the outside, working around, leaving the outside of my hand last, and then moving on to the rest of my fingers. And I'll be doing each 10 times. Now before I go to my thumb, I will be doing the sides of my hand. Now the face of my palm. Back of my hand. Now I'll be doing the front, sides, and the backs of my arm. All the way down to my elbows. Now I will be going to the other hand. This will not make my hands sterile. This is just going to get off the excess normal bacteria that we carry on our skin. You want to be careful not to rub too hard to exfoliate, because that will bring more bacteria up to the surface. To do the tips of my fingers. Okay, now I'll be rinsing my hands off, starting with the tops of my hands, working my way down to my elbows, not touching anything. So it's dripping downward. Okay, now I'll be moving into surgery. Okay, now I'm going to get my towel. Just going to open it up and just dry my hands. Again, starting from the tops of my hands down to my elbow. Being careful not to drip onto my sterile site. Okay. Now, I'll be moving this, which was sterile. Now I'll be taking my gown, moving away. Okay. I'll be doing closed gloves, so I'll be leaving my hands in my sleeves. Okay, can you stop it? All right, so now I'll be gloving up, closed glove. So I'm going to get my gloves ready. These are still, came out of the sterile packaging, so. Get my gloves set back up. Okay, so I will be grabbing the middle part. Off the hand. Keeping my hand in the cuff of the gown. So now I have this sterile hand. I can grab my right glove. Again, keeping my hand still in the cuff of my gown. Down as far as it will go. And getting my hands, fingers put in there, and the cuffs just as proper as possible. If I were to break sterility while gloving up, meaning if I drop my glove, if I touch my glove with my bare hands, I would ask the scrub assistant to come back in and get me a new set of gloves to use. Again, like with the instruments, if one were to fall on the floor or touch an area outside of the sterile surgical field, then we would just open up a new pack or get a new sterilized instrument. Okay, now I will be making for sure to keep my hands out, so I'm not going to touch anything unless it's sterile. So now I have my scrub tech pulling up the surgical pack that we'll be using. Right here we have the towel for the doctor to dry his hands. I have my OK strip just showing that it was autoclaved. So it's still sterile, just set it right there. I have my German scissors, and then this is the drape that we will be using. And what I'll be doing now is just counting my gauze. Okay, so there's 20 in there. And now I can just start laying out my towel clamps, getting them ready to use. And I will be placing my instruments, my straight hemostats, Alice forceps out, ready to give the doctor as needed. My scalpel blade. Now my curved tip, needle holders, forceps, curved hemostats, and scissors.
Yes.
forceps. Alice tissue forceps. Thank you. Scalpel. Thank you. Tissue scissors.
Would you like the medicine ball?
Yes. Thank you.
Go ahead and plug it.
Just
How many minutes are we at?
4.
Okay, let's go ahead and stop it. The surgery is a canine neuter. Asculating the heart and lungs manually. Okay, the surgery that we're performing again is a canine OHE. And earlier we were having issues getting the blood pressure to read, and then we were getting some low readings. So we kind of messed with the cuff a little bit, and then we informed the doctor, and he wanted us to wait to see what he got in the surgery. And we are getting a better reading. Our last one was 114 over 49, or 59 rather, and then the mean is 77. So the systolic number on top is 114, systolic is 59, and then again our mean was 77. Probe.
are a little light, but her capillary refill time is still less than 2. She is stable again. She was kind of getting light whenever he was pulling on that right ovary, so I'm going to turn her back down now that we're more stable. I'm going to manually listen to her heart rate without getting in the surgical field. I'm listening to her lungs. I'll be recording what I get and then matching it to what my monitor says, which they are on target. And I will be taking more vitals every 5 minutes. So in this video, we're doing a feline neuter. The doctor's getting all ready, scrubbed in, drying his hands off. This video is just showing that I'm participating in a feline OHE. Right now I'm just getting a heart rate. And get respirations manually. Show what I'm documenting. We have the client information, patient, weeks. She's 11 weeks, 6 days. Just showing sex, breed, color, everything specific to the patient. And then just showing that I'm going to document every 5 minutes vitals, including pulse, respiration, blood pressure, oxygen rate. We're not monitoring CO2 because she's on the non-rebreather, isoflurane, and then her O2 liters that we're running her on, and then checking her mucous membranes and capillary refill time. Video, what I'll be doing is just getting my instruments ready to be taken to be soaked and then autoclaved. So I'm going to find my needle holders and my blade holders, and I'm just going to be getting rid of the sharp. So I'm just going to take this and push it forward till it comes off, and then I'm going to take it to the sharps container and just place it in there. And then I've counted all my gauze. We have 20 in there, which is where we started, and then I have my needle and my suture pack, so I'll just be taking that out and then putting this in the sharps container. Since there's not a lot of suture left, I'll just leave that part on there. And then from here, just see, using some of this gauze, it's not really bloody.
Throwing the used gauze away after counting to make for sure they're all there. And now I'll be taking this to be soaked in the autoclave room. Okay, so now I'll be cleaning the surgery room, starting with vacuuming the floor. My rescue wipes and just wiping down the surgical table, the lights, anywhere that might attract fomites and dust. Handles. Now I'll be doing the surgery table, starting from the top. Deep pull and then working my way down to the bottom. Also be doing any other areas that we had instruments and surgery. And then now just wiping the anesthesia machine down, making for sure it stays free of dust and any other fluid or particles that can float around during surgery. And then after, I will be mopping the floor with rescue concentrate. Okay, all right, and I just wanted to remark that we don't have an actual tray, we just have a bucket, so, and that was not utilized today. So just making for sure that it is clean. We didn't use the kick bucket, but if it were to be full, then I would replace that trash. But I will be replacing our big trash can and putting a clean bag in here for tomorrow. So now we're gonna clean our pack. I just want to note that the blade is off the blade holder. I've got my mixture up with my cleaner, and then we put a little bit of instrument melt. So I'm just going to take my instruments, put them into the solution. Make sure they're all the way in there. Let them soak for a few minutes and come back and clean. So now we're going to be cleaning our instruments. I have my wire scrub brush right here. I'll be getting into the teeth, making for sure that all the blood and tissue is removed. Going to run it under the water. That one looks good. From here, we'll be putting it into the ultrasonic cleaner, making for sure that nothing is sticking out. lathe, I will not be cleaning with the wire brush, just due to it could cause dulling, so I'll carefully do it with my fingers, again making for sure there is no debris or tissue left. And I will just keep continuing to do this with all of my instruments. The ones that have horizontal teeth, I will be going with the groove. Whereas the ones that are vertical, I'll be doing it vertically. So once they are all in the ultrasonic cleaner and they are all submerged in it, I'll be placing the lid on. It is set at 30 degrees Celsius just to make for sure that they get disinfected properly. And be setting it for 9 minutes, and when it goes off, we'll be wrapping it and then putting it to the autoclave. So I am putting lubricant on the lock boxes, and I will wait for them to dry before I pack. In this video, I'll be putting a surgical pack together. I made for sure that my surface area was clean. I have my tray to put the instruments in. I'm going to be putting a hook towel in, but before I do that, I'll be rolling it. I have my straight instruments in order from shortest to longest. Made for sure that these instruments were clean, lubricated, free of hair and blood before I put them into my tray to be autoclaved. So these are going to go on one side, and I'll put my curved instruments on the other, going the opposite direction. So, and I've got my spade hook, my rat tooth, my hemostats, and blade holders will be going in the middle. Keep it in a neat fashion so it's easy for the veterinarian to access the instruments that they need during surgery. Lastly, I'll be putting my towel clamps just anywhere. Now I'll be putting my gauze squares. I'm going to put enough in there so the doctor has plenty for surgery if needed. Next, I'll be putting my surgical drape that was pre-cut right there. And then I need to get my autoclave strip. This is going to let us know that the autoclave reached the correct temperature internally, so we know that the instruments were sterilized. On top of that, I'll be putting my Pakistan scissors and 2 more hook towels for the doctor to dry their hands. And now we're ready to wrap the pack. For sure this is free of hair and debris on the inside. I want to make for sure that this is tight so it creates a seal and keeps sterility. So I'll be folding it in an envelope fashion. And tucking it in so it's staying together itself. So now I'll be taking just a regular piece of masking tape. Try to put it on there tightly. And then I have my autoclave tape. Taking just enough for a couple of lines. Again, this is gonna make for sure that when we put it in the autoclave, that it's sterile when it comes out, it reached the proper temperature. I'm gonna label the pack. My initials and the date that it was done. And now it will be ready to be autoclaved. In this video, I will be folding up a surgeon's gown. So the first thing that we want to be sure of is that our arms are going to be on the inside. So I can do that just by folding it inside out. Okay, and then I'll be shaking so the arms fall down. Now I'll be folding in quarters. So what this does is when the doctor or technician goes to open it, doing it right, they will pull it up by the shoulders, and then it will be all folded out in the right position for them to guide their hands in. So now we're gonna wrap it. I'm gonna take my towel and just place it on top so the doctor or technician has something to dry their hands off with. And I'm gonna take my wrap. Just gonna fold it envelope style, making for sure it stays tight. All right, so I'm gonna start the autoclave. So I just wanna show that these packs, we just wanna put them in there to where they're not overlapping each other. And then I'm just gonna put this one right here, just so it's loosely in there. And then what we're gonna do is we're gonna make for sure it's on the right temperature. We have that set to 273 Fahrenheit, and we're gonna fill the water. We're gonna wait till it gets down to the line right here in the reservoir. Okay, once the trench is completely full, I'm gonna go ahead and I'm gonna turn it to sterilize. Lock it. Okay, we're gonna start the timer for 60 minutes. Okay, and we're ready to go. Okay, so the autoclave is done now, so we can see it did reach the proper temperature. It's past 274, so I'm just gonna turn it to extra dry. And we're just gonna wait for this little white needle to go down so we can open it. So now we're gonna talk about maintenance for the autoclave. Daily maintenance is just making for sure that you wipe it down and keep it clean so dust doesn't collect. And we do that with the rescue wipes. So just kind of wipe it down on the doors and on the side over here. Make for sure there's no dust getting up into the vents. And then also we want to be checking it with each use and making for sure that the water is properly filled to the level with distilled water. Monthly, we're going to drain it, and how we do that is we're just going to take this hose right here and we just undo it. So we're going to unscrew this little part right here and then let the water go into the bucket right here and then just fill it back up with distilled water. So now that we are done autoclaving, we're just gonna check and make for sure that it reached the proper temperature which it did. You can tell right here by looking at our autoclave tape how it did blacken the lines, so we know that it is sterilized and ready for surgery. So in this video I'll be doing a suture removal. So I'll take my hemostats and pull that up. Just gonna come up under the knot, and you can see that it's all been removed.